Today, I'm going to talk about the signs and symptoms of ADHD in teenagers. And if your teen is experiencing some of these symptoms, maybe it would be time to have your teen evaluated for ADHD. Hi, I'm Dr. James Thatcher. I'm a clinical psychologist and I'm the medical director here at Forest Psychological Clinic. And before I start talking about the different symptoms of ADHD and trying to give real life examples on what they look like in teenagers, I want to talk about why I'm doing these videos. Because these videos take a lot of time to research, write, film, edit, upload. However, the reason why I spend hours and hours doing these videos is because I think that if people can learn about these topics and improve their lives, then it makes it all worth it for me. So I really do hope that this helps you. And now, let's get into it. So ADHD, other known as attention deficit hyperactivity disorder, is a neurological issue. It would have been around since your teenager was little. And what may have been occurring is that you may not have seen it, or you may have just gone, well, that's just who they are. And you'd be right, that is just who they are. And as they've gotten older, things get more difficult for teenagers, right? So academic demands get harder, social demands get more difficult. Now they're forming relationships or interested in the opposite sex or the same sex, and they're developing different feelings. Kids can become more cliquish, so social situations get more complex. And when that happens, maybe that when they were a kid, a lot of these behaviors seemed normal. But now as they get older and all these demands increase, now you're starting to see the cracks. Now you're starting to see them struggle and have a lot of trouble at school and in their social life. So to talk about this a little bit more, academically, you may be seeing their grades go down. You may see them having trouble turning things in. Socially, you may also see that they're becoming more impulsive, or they're hanging around individuals that aren't so good, or maybe they're being bullied, or maybe they're not thinking through with their actions, and it's becoming more and more of a concern. So let's talk about the symptoms of ADHD, and I'll try to give some real life examples on what goes on in teenagers with ADHD. And if you stick to the end of the video, I'm also going to talk about some other issues too that can occur with ADHD, like hyperfocus and sensory issues. So please stick around for that. So the first set of symptoms in ADHD, again, that's attention deficit hyperactivity disorder, is inattentive symptoms. The first one is they're failing to give close attention to details, make lots of careless mistakes, rushing through things. In this one, you're going to see, especially in their homework or in their chores, that they're just going to just kind of rush through it, and it's not going to be fully complete, or a lot of their answers are going to be just inaccurate to where if they had slowed down and focused, they would have known the answer. The next one is difficulty sustaining attention in different activities. So this would be that their mind gets off track pretty easily. Maybe they're having a hard time following lectures, following longer conversations. They tend to just zone out after a while. And that kind of leads me to my next one. So not seeming to listen when spoken to directly. You might be having a conversation with them, and then after the 3-minute mark, did you just hear what I said? Because you see their eyes glazing over, they're looking at the window. Maybe they were listening to you, maybe not. But having their mind wander. Next one is often not following through on instructions, failing to finish things. And this isn't that they're being malicious, to where if you ask them, hey, I need you to put up your shoes, make sure to do your laundry tonight, and I need you to take out the trash. And can you do that within the next half hour? Oh, yeah, sure. And then maybe they put up their shoes, the first thing you ask, and then the other two things, no, they just get sidetracked. It's not like they're being oppositional or that they don't want to do it. They more likely legit want to do it because they know these things need to be done. It's just they get sidetracked so much that they can't complete it. Next one is trouble organizing tasks or activities. That's, being able to keep things together, meet their deadlines. It can also mean poor time management. So getting really sidetracked with different things and then, oh, hold on a second. Oh, crud, I was supposed to go do that thing. I completely spaced. I forgot. And this keeps happening. And I should say all of these symptoms, everyone does these now and again. But when these symptoms happen the vast majority of the time, 80% plus of the time, that's when it starts becoming a concerning issue, right? Like we all forget things, we all get sidetracked, we all don't do everything that we need to do. It's only when it happens day after day after day for the majority of the day does it become, hey, there might be something more going on here. The next one is often losing things or necessary materials. So when they were little, maybe that was pencils or art projects or just little things here and there. But as they get older and they have more responsibilities, now they're losing more important things, right? Their wallet or their keys or their phone all the time. And they're like, oh crap, I forgot this thing. I need to go back to the house and I need to go get that. And that happens fairly often. The next one is getting easily distracted by things. So, as a teenager, maybe that's things that just pop up in their mind, and you'll be having a conversation with them and about, hey, what are we going to have for dinner later tonight? Or, hey, later this weekend, we're going to go to grandma's house. And maybe you can follow the logic of it. Maybe they bring up their friend Todd, or they start talking about one of their favorite video games and you can see the loose association on what they may have, why they have thought that way because you know them so well. But to an outside perspective, it would be like, what? That came out of left field. Why would you say that? And so for younger kiddos, because again, ADHD, it's a neurological issue. So this would not just be popping up when they're a teen. This would have been going on since they were a kid. And for younger kiddos, maybe that's they see something out the corner of their eye and they look at it. Or even as a teenager, they see something out of the corner of their eye and they just get distracted by it. So it's kind of like one of those squirrel moments, right? So where you see, oh, hey, look at that over there. Oh, I forgot what we were talking about. So the next set of symptoms that happen in ADHD is hyperactive behaviors. So that's lots of fidgeting. They got to have something in their hands. Maybe their feet are bouncing quite a bit. They just can't quite stay still. The other thing that I should say is sometimes in teenagers you're going to see these things, but some of the times you may see more hyperactive behaviors be more prominent when they're younger, when they're more of a kid. So you'll see them be more full of energy, and I'll get into that here in a minute. But as they get older, they learn different coping skills on how to tamp that down or how to mask that. So even though they might have all these urges to be more hyperactive, they've learned some different ways. And sometimes not. Another one is often leaving their seat when they're expected to stay there. Maybe that's you guys are trying to watch something as a family, and then every 5, 10 minutes, they just got to get up and move around. Or you're trying to have dinner as a family, and again, they just always have to get up and get something or move around a little bit. It's just like they're full of energy. And that's another one too, is just being full of energy. Bouncing off the walls is another way to put it. And again, you would mainly see this when they were younger. Another one would be talking excessively. So just talking about subject after subject, kind of monologuing at you. Another one, especially when they're younger, but maybe as a teenager too, to where they just can't play quietly. So maybe when they're playing video games, they're just getting really into it. And some of that may be normal teenage behavior to where they're just really engaged with that first person shooter game that they're doing. But it also may be like they are doing this the majority of the time, regardless of how stimulating this game is or not. Another one is blurting out answers before you can finish your sentence. So this would be them finishing your sentence for you, or they just can't wait their turn to say what they have to say. They may interrupt you. And that's another symptom is interrupting other people. And that could be verbally, but that could also be in the middle of an activity to where they see you doing something and they just take over. But you'll mainly see that for an older teen or an adult. So with these different symptoms, you've got to meet 6 or more in each category. Categories being the ones I just talked about, the inattentive and hyperactive type. So you got to meet 6 in inattentive or 6 in hyperactive if you're 17 and below. So 17 and younger. But if you're older than 17, so we're talking about an older teenager, young adult, then you only need to meet 5 of these issues. And another thing about ADHD to keep in mind, kids may have been able to mask it, or it was just kind of normalized. Hey, this is just how Timmy is, or this is just how they've been. And again, you would be right. But as social demands and academic demands increase over time, it becomes more and more of an issue. And also, as folks get older, they learn other coping skills on how to deal with it. So maybe they've learned how to mask even more as a teenager, and they're still having a lot of these difficulties, but they've learned some strategies around it. And in doing that, it can really just wear them down. It can be overwhelming sometimes, and it can lead to burnout and some other mental health issues to look out for. And the other thing with ADHD is that there's 3 different types. There's the inattentive type, hyperactive type, and combined type. And essentially what that is if you have an attentive, well, then you're just meeting the criteria for the 5 or 6 if you're younger than 17 of the inattentive symptoms. And same deal with the hyperactive. 5 if you're 17 and older, 6 if you're 17 and below. And combined means that you just have both, to where you both have inattentive symptoms and hyperactive symptoms. As promised, I would also talk about hyperfocus and sensory issues that tend to happen with folks with ADHD. Another thing to keep in mind about ADHD is it's not that they have a lack of attention. This part really isn't quite true. What rings more true is that folks with ADHD have a difficulty policing their attention. So being able to control what they pay attention to. This may look like that they need to get their homework done, but they just have to do this Sudoku puzzle first. Or that they have an essay that's coming up, but man, they just got to finish this level in the video game. And that's another thing to where you may see them just like, well, I don't think he has ADHD, or I don't think that she has ADHD, because they can spend hours and hours on a video game and focus just fine. The thing to keep in mind about a video game, though, is it's very stimulating. And that is a lot of what ADHD folks are looking for out in their environment, is things that are stimulating for them. So that's why with untreated ADHD in teenagers, you may see them being more impulsive or choose bad friend groups and just do things that are more risky. That's another thing to keep in mind. And I can always make another video about that. And the other thing, like I discussed before, is sensory issues. One thing that can get overlooked with folks with ADHD, and it kind of looks like it overlaps with autism, and it very well could. And I've got another video about autism and ADHD and how the two can overlap with one another. But with ADHD, again, it's a neurological disorder. So the brain is wired just a little bit differently. There's been a lot of research coming out to where ADHD can have a lot of sensory processing issues that could look like that they're sensitive to certain foods or textures or sounds or lights, and all of this can be overwhelming for them, or they just have a visceral reaction when you offer them a certain kind of food. They just like, I cannot eat that, that's gross. All right, so if you like this video, please hit like and subscribe. It really lets YouTube and myself know that you enjoyed this content, so we can keep making it for you. And if you liked this video, go ahead and check this one out. I think you would really enjoy it. It's the ADHD and autism one that I talked about, and how the two can overlap, because there is a lot of co-occurrence between those two. All right, hopefully I'll see you there. Bye-bye.